You're listening to Channel 98.9. This is Silvis, and it's time now for Blue Zones Project Corry Speaker Series. And with me in the studio today is Ashley Lawson and Shannon Wolford from Blue Zones Project. And we have our guests today from the HRSA Implementation Grant. It's Megan Toth and Kaleigh Gustafson, their mobile case managers.
Okay, so I am so excited to have you ladies with us this morning, and I just want to kind of back up a little bit for our listeners so they understand kind of what you're doing here and why the connection with Blue Zones. So I want to talk in a broad sense about well-being, and with Blue Zones, you know, we understand that having good connections and having a network of people around you who can support a healthy lifestyle is really important to our well-being. So it's not always just about what you're eating and how much you're moving your body. That's what I love about Blue Zones. There are these 9 factors that really are interwoven, and we look holistically at what well-being is for an individual and a community. So we're excited to partner with the HRSA grant, and I want you both to introduce yourself and just tell us a little bit about the work that you're doing and how that kind of ties into community well-being.
Thanks for having us.
Yes,
This is exciting. So I'm Kaleigh Gustafson. I am a mobile case manager for the Women's Recovery Center out of Franklin, actually.
Okay.
And that's through Western Behavioral Health at Safe Harbor, a UPMC facility. We just recently opened in March. You know, the program itself is new to our community, as is the program, you know, Megan's doing the same role that I am here in Corry. It is new to our smaller communities in Corry and Franklin, but it isn't new to Pittsburgh and Erie,
Sure.
where it was implemented. And so the model that we do is based on what was so successful in those bigger hospitals. So that's kind of our role, is really to kind of bring the recovery community and women specifically who have a history of substance use disorder and kind of support them in a setting that isn't specific to just substance use disorder, but we really kind of link them and tie them to the different agencies and resources.
Well, and I think by doing that, you're making it kind of the norm. You know, let's not make this something we can't talk about, or that you should feel shame or guilt or badly about if you're going to seek help. I mean, I think that's what's wonderful about the work that you're doing and how you're tying into communities, because we really want people to know if you need help, there are resources there for you. And we really want to encourage people. So, Megan, let's hear about what you're doing here in Corry, because we're excited to have you in Corry and have these resources for people. So tell us a little bit about it.
Okay, yeah. So, I'm Megan Toth. I'm the mobile case manager here in Corry. And that was something that was just so important to us, is to get more resources to rural areas. A big part of the HRSA grant is the idea that recovery is community. And so it's not about just having one tie to help you through battling with mental health or substance use. It's about having many ties working together to help you achieve whatever your goals are for your well-being. And so,
I mean, I love what you just said about, you know, it's more than just one thing. You know, you really do have to create that network. And, you know, I think that's really what kind of parallels with what Blue Zones Project is all about, because as Ashley could speak to, it's really about creating a healthier environment.
So as we look around our community, we talk about connectedness. And in this Blue Zones case, you know, that is connecting resources. We talk often about connecting trails or assets or parks to schools, but there's so much more than that. And forming all kinds of connections within your community with your friends and neighbors, and in this case, support groups and agencies who are here to help and want people to take advantage of services and really help people establish whatever lives they want to live in this community, and are here to support family and friends. And part of that means nutrition, and part of that means financial education for a lot of people. And sometimes it's just an opportunity to connect with like-minded individuals or find a healthy activity that you can do either by yourself or with your family.
You're listening to the Blue Zones Project Speaker Series on Channel 98.9. Today we have Shannon Wolford and Ashley Lawson from the Blue Zones Project, as well as Megan Toth and Kaleigh Gustafson, their mobile case managers with the HRSA Implementation Grant Program.
Kind of wanted to elevate that whole concept of the connection, because let's just take someone that wants to create a healthier lifestyle. I mean, we talk about willpower, like, oh, well, why didn't you just have the healthy breakfast instead of the Pop-Tart, washing it down with your Coke? Well, folks, I mean, that's why the environment is so important, because you can't do it alone. It's really hard, and we don't expect people to always make those good choices. But when we can create an environment where you can make the healthier choice because it's easier to make, then guess what? You don't have to rely on your own willpower. It's going to be easier to live a healthier lifestyle. So we are so excited to have Megan here and Corry to have these services for women in this community, in the rural communities, because they are so necessary. You talked about the model in Pittsburgh and what made it so successful, and how is that being translated into the rural communities?
So I think it just really reflects on what you're saying about connecting all of those paths. There are all these different resources out there, but I think in rural communities especially, the connection is what's missing. And especially in recovery, my life doesn't look the same as yours, and somebody who struggled with substance use doesn't look like someone else's life who struggled with substance use. And what we've done, and what was so successful at McGee in Pittsburgh and at Hammett in Safe Harbor in Erie, is meeting women where they're at. None of us are walking the same path. We're all living this life together. So expecting us to all do things in exactly the same way, shape, or form that the person beside you does is not realistic. It's not realistic for anybody, let alone someone who has maybe lived their entire life surrounded by mental health and substance use disorders. And I think respecting that everyone's journey is different, and meeting them directly where they are in their life, and not saying, well, when you get to here, we'll help you. It's those connections that you're talking about.
Absolutely. And Megan, tell us a little bit about what services you are providing here in Corry. Is it about prevention? Is it education? Is it counseling? Tell us a little bit about the details of how you are implementing the work here.
So there are a lot of things that we are trying to do in Corry, from outreach to prevention to case management with different clients. So with outreach, we are set up at the farmers markets on Friday down at the park. We are participating in First Fridays, and we're trying to just have a presence in the community and get to know different organizations that are in the area, different contacts for us in order to build those stronger connections. We're also trying to increase our prevention efforts. An important thing for us is teaching the proper disposal of unused prescription medications, because we want to, one, prevent misuse from individuals and also prevent overdose. So we're trying to partner. We're working on partnering with the Corry City Police to work on medication drop-offs. And something that we're also trying to focus on is Narcan education, which is a life-saving medicine that prevents overdoses. It's a great resource for individuals using substances, loved ones who are worried about their family or friends who are battling with substances, or just other members of the community who think that would be an important tool for them to have in case they're in a situation where it'd be beneficial to use it. And then just case management, where we're working with individuals who are struggling with substance use and some mental health concerns, and to be able to work with them personally on what their goals are and what, steps we need to take in order for them to reach those goals.
Awesome. If someone has someone in their family, they have a concern about substance use or abuse, or they want to learn more, how could someone reach out to you, Megan, for more information?
Yeah, sure. So I am at Corry Counseling Office. I have an office in there. My phone number, 814-651-3942. And in case, phones are a little bit scary, I also have my email is Toth, m7@upmc.edu. And so those are two great ways to get a hold of me.
If you're out there and listening and you're like, hey, I would love to learn more about Narcan or how to get rid of unused medication that's been sitting in my cabinet for the last month, be sure to connect with Megan either through the information she just shared or, like she said, she's been out and about in the community at the farmers market, at the First Fridays events. You know, these are small steps that people can take to really create a safer and a healthier community for everyone. So we're really excited to have you two ladies here to be sharing this great work you're doing, and excited to have the support here for those who need the help. So thank you so much for taking part in this.
Thank you.
And thank you
Thanks
for having us.
You've been listening to Blue Zone's Project Speaker Series on Channel 98.9 with Ashley Lawson and Shannon Wolford from the Blue Zones, and our special guests today, Megan Toth and Kaleigh Gustafson. They're mobile case managers with the HRSA Implementation Grant Program.